Doctor, I have diabetes. How can I take COVID vaccination? Now I have been diagnosed with diabetes. That's all. Should I take the medications or insulin for lifelong? Does diabetes cause hair loss? Some questions are like, diabetes cause obesity. Low sugars vanduchina, it is more dangerous for elderly than having a sugars of 200. Vanakkam. I am Dr. Smitha, consultant internal medicine, diabetology and lifestyle medicine physician. I work at SIMS Hospital-Vadapalani. Many patients have the doubt, doctor, I have diabetes, how can I take COVID vaccination? I have heard so many bad things and rumors about COVID vaccination. No, diabetes irukravanga indha mari problem irukravanga COVID vaccination edukudadu, nariya complications, some people have died also. It is all a myth. Actually, it is, if you don't take the vaccination, it is more dangerous than taking a vaccination. The side effects of taking COVID vaccination in a diabetic is almost the same as general population. For general population, COVID vaccine eduthona inna side effects varu, mild fever varala, body pain, and injection site la there may be some little bit of swelling and pain. The same side effects will be there in a person who is diabetic and taken the COVID vaccination. But if you take 2 doses of COVID, you are very well protected. You may still get COVID, but it will not be as fatal as if you don't take the vaccination. So, my advice to all the people who are diabetic, whether controlled, uncontrolled, you should all take COVID vaccination. Diabetic patients who are elderly should definitely take the booster without fail, because these will increase the antibody titer and be helpful. The other question, person when he is newly diagnosed or a person who is diabetic from long years, is it always permanent, doctor? Now I have been diagnosed with diabetes, that's all, my life is over. Should I take the medications or insulin for lifelong, or can we cure it? Yes, actually when we find out diabetes in early stages, or when the person is like recently newly detected diabetes, we can reverse diabetes. So, what is reversal of diabetes? Reversal is when our HbA1c is less, it comes in normal range, that is less than 5.6, fasting glucose is less than 100 and postprandial is less than 140. These are the criteria to tell the person is in normal range of sugars. This has to be maintained for at least 1 year without any medication. அப்படினா நம்ம சுகருக்காக எந்த டேப்லெட்ஸ் எடுக்கிறதாகட்டோ இல்லை இன்சுலின் ஆகட்டோ எதுவுமே இல்லாத only lifestyle changes. அப்படினா balanced diet, exercise, நம்ம ஓவர் வெயிட்டாக இருந்தோன்னா வெயிட் ரெடியூஸ் பண்ணிட்டு இந்த மாதிரி மெயின்டைன் பண்ணிட்டு இருக்கும்போது நம்ம சுகர்ஸ் நார்மலாக இருந்தது and that too for 1 year period இருந்ததுன்னா we can tell that a person has reversed diabetes. பட் நம்ம ரிவர்ஸ் பண்ணிட்டோன்னு சொல்லிட்டு நெக்ஸ்ட் டைம்லேருந்து நான் என்ன வேணால் சாப்பிட்றேன், ஜங்க் ஃபுட் சாப்பிட்றேன், ஆர் ஐ எம் நாட் எக்ஸசைசிங், இந்த மாதிரி பண்ணோன்னா அகெயின் யுவர் சுகர்ஸ் வில் இன்க்ரீஸ். ஸோ தே ஹாவ் டு பி இன் ரெகுலர் ஃபாலோ அப் வித் த டாக்டர் அட்லீஸ்ட் ஃபார் மோர் தென் 5 years and follow the healthy lifestyle changes which they have done already to reverse diabetes. So, you should always take the advice from a doctor who is trained in diabetes and who is following this kind of reversal patterns. Does diabetes cause hair loss? As I have told already that diabetes is a systemic disease. Because of glucotoxicity, there will be reduced blood supply to the scalp. This is like vasculopathy, which can lead to thinning of scalp, thinning of hair on the scalp, and it can also lead to a different pattern of hair loss like alopecia areata, where patches of hair on the scalp are lost. Some questions are like, diabetes cause obesity? No, actually diabetes per se does not cause obesity, but obesity causes diabetes. So, we are talking so much about obesity. So, what is overweight and obesity? When we take a person's BMI, what is BMI? BMI is a person's weight divided by height in meter square. So, for Indians and Asians, the BMI should be only around 23. When it is more than 23 up to 25, we tell a person is overweight, and when it is above 25, we tell a person is obese. This being overweight and obese are one of the main risk factors for many of the chronic diseases, leave alone diabetes. It can be for hypertension, for dyslipidemia, heart issues. The most of the chronic diseases are caused by being overweight and obese. So, many people who have done who are morbidly obese, who have undergone bariatric surgery and all, have reversed their diabetes and they are in reversal stage. But diabetes does not cause obesity. Sometimes when we are prescribing some of the drugs like sulfonylureas, they can cause hypoglycemia. Such patients, in the fear of hyperglycemia, they keep snacking, so that they think my sugars are going to come down, so I better eat something, and they keep taking snacks in the evening or midnight. When they snack, repeated snacking can increase their weight and lead to obesity. And there is a drug called as pioglitazone, which changes the fat distribution in the body. It puts on more fat around the abdomen. So, abdominal obesity is also one of the risk factor for cardiovascular diseases and other chronic diseases. This obesity is also one of the thing for metabolic syndrome. When we speak about elderly and diabetes, we have some special considerations, like their HbA1c need not be very tight target of like 6.5 to 7. Sometimes we can give some lenience in their HbA1c, it can be maintained even to 7 to 7.5, because in elderly hypoglycemia is more dangerous than hyperglycemia. Abdina avanga low sugars vanduchina, it is more dangerous for elderly than having a sugars of 200, because any episode of hypoglycemia can sometimes lead to giddiness and fall in elderly. Some falls can even lead to fractures, and elderly are more prone to hip fractures. So, this will again make their life very miserable, and their mortality will keep increasing with fracture and repeated episodes of hypoglycemia. And some elderly may not be aware of hypoglycemia. This is called as hypoglycemic unawareness. அவங்களுக்கு low sugar வரதே அந்த symptoms இல்லாத இருக்கும் அவங்களுக்கு. So, they may not be aware of it. And some elderly may take, when they have dementia or Alzheimer's disease, they may not be regular with their medications, or sometimes they may take the medication even 2 or 3 times, leading to low sugars. So, such things have to be very much, like when we are dealing with the elderly, we should keep all these things in the mind.